Today on Keynote.
Ultimately, we want to get to the day where cancer in children is no longer a life-threatening disease, but something that can be solved.
My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Our Keynote show is designed to share conference-level value with you every week. Now, let's jump right into the episode.
Welcome to Keynote, where today we are honored to welcome back a truly inspiring leader, Liz Scott, co-executive director of Alex's Lemonade Stand Foundation. For those of you who may not know, ALSF began with a simple yet powerful idea. Liz's daughter, Alex, was just 4 years old when she started a lemonade stand to raise money for childhood cancer research. That small act of generosity sparked a national movement that has now raised over $300 million to fund groundbreaking research, support families, issue over 1,500 grants, and bring hope to children battling cancer. This is now our third annual conversation with Liz, and over the past few years, the This Week Health community has joined the fight through our Yellow Hat Club, raising over $218,000 with an ambitious goal of $200,000 just for 2025. These yellow hats are available for $500 on our website to donate. Liz, it's always a privilege to have you here. Thank you for the incredible work you do, and welcome back to the show.
Thank you. I am very excited to be here. You guys are just doing phenomenal work with us.
For us, it's a sense of purpose every single day. And I want to talk about the power of community and our new Yellow Hat Club that we founded last year. So the Lemonade Stand, or the foundation, has grown from one lemonade stand into a movement. How have the grassroots and corporate communities helped accelerate this impact?
The grassroots and corporate communities are everything to what we're doing. They drive every single thing we're doing. When Alex set up 25 years ago now in our front yard, she just wanted to do something to help other kids like her. And she inspired people very organically to set up lemonade stands and to do what they could, a part of it. And really, since then, now 25 years later, that has not only continued, but grown. And efforts like yours and the lemonade stands that go up across the country, all of our corporate partners, people are really just going into their communities and saying, this is a cause that needs your help, and here's a way you can support. And it's been very powerful and truly enabled us to fund the research and make the progress and help the families that we've been able to help.
What does it mean for the foundation to see industry beyond healthcare providers, such as healthcare IT leaders, step up to fund research and support programs for families?
We couldn't do what we do without it. We rely on all of these donations. That's why our slogan is one cup at a time. All of the efforts collectively across the country, efforts like yours, where you're just telling people, here's a way you can help, and you make it fun, which has been a big part of what we're doing. I think the yellow hat concept is a really fun and creative idea. And at the end of the day, it's making a huge difference. It's driving change. It's allowing us to do things to change the future for kids with cancer, and it's working.
The impact of $500, $50, any amount that is given, when we think about, we specifically chose 500, how does money like that help a family facing a cancer diagnosis?
There's a couple of things we do with donations. So $500 is a significant donation for us. Every donation counts. It all adds up. But I'll tell you, as an example, one of our grants would equate to $50 an hour, right? So that would be 10 hours of research. And you just never know what hour is going to result in a cure. And all of those hours together, if you multiply that by what we've raised, has resulted in 1,500 research projects looking at cures for virtually every type of pediatric cancer. We also offer family support services, and $500 actually goes a long way for our family programs. We help families travel to care. So $500 is a little below average, but a typical amount that we might need to provide to get a family to go to a hospital for an innovative therapy. We have a sibling support program. So $500 would support about 10 siblings through that program, and us being able to provide them with comfort and empowerment and care and educate their parents on what's happening with siblings. Our Flashes of Hope program, which is a photography program, $500 would allow us to photograph many children and provide their families with these beautiful photos as mementos. It does a lot. We're able to put it to work quickly, and we're able to do a lot with every single dollar that we get.
When the new programs have emerged, and you've spoken about this in your previous interviews with us, that, hey, we realize that siblings need help. We realize that travel is a part of it. When a new need pops up that you have not encountered before, how do you operationalize it? How are you getting it into motion in a way that allows you to serve beyond the reach of what you started with?
It's a great question. We have a constant list of gaps and needs that we know are out there. And as we anticipate raising more money, or as we raise more money sometimes, we know that we have a place we want to spend them, and we try to be ready to spend it. So we'll start working in advance so that when we have the funds, we're ready to mobilize them and use them. And I can give you an example. We funded these project called Crazy 8. They're $5 million projects. So that was a huge commitment, right? We funded 7 of them. And then we realized we were trying to solve the hardest problems in pediatric cancer. And then we realized there were a whole bunch of problems that we weren't addressing that could use this sort of huge, large scale, big idea, collaborative, cross-institutional grant to bring people together to solve a problem. We identified predispositions in children that make children more likely to get cancer as a growing topic and a huge need that didn't have a lot of funding. We wanted to fund one of these $5 million projects, but we knew we didn't have the money just yet. So we actually went out and actively raised that money from some individual. In the meantime, we got this RFA, we got the process ready. When we raised the money, we put the RFA out there. And not only did we get one impactful project, we ended up getting 2 that were so complementary and impactful that we went out and raised a little bit more, and then finally just said, this is the right thing to do. We're going to commit to this. And now we're going to raise the money over the next few years to make sure that we can keep that commitment to these projects. They're incredibly impactful and really important in the space of predispositions.
Wow. And when you think about creative ways that companies or individuals can start their own fundraising initiatives, you've touched on some before. What are you seeing today that is just out of this world and things you didn't expect? And you're like, dang, these groups have donated all this money from these ideas. You talked about the pet contest and so many fun things. What are you seeing the last year or so that has really just sparked a level of creativity that makes you realize, wow, there are so many things we can continue to do to raise money?
Honestly, I think what you guys are doing is really creative and smart because you're building community within your community. You're giving people like that little extra reason to make a donation, and it's visible. So it's almost its own sort of awareness building for Alex Eliminates Stand and childhood cancer. So that one I'm going to use with others as I describe it. I would say another thing we've seen is in the sort of getting the next generations involved beyond lemonade stands is trying to do more with streaming and content creators who have a built-in audience, and they're able to do one of their streams and talk about Alex's and ask their community to donate, very much like what you're doing, but they're using their voice in a very different way and a very different platform. That I think is a growing area, and we're picking up some momentum in that area. We have a big event in April on Tiltify where we're getting content creators to commit to streaming to support us. And I see that as a growing opportunity for sure.
I love that. And then when we think about how the foundation has helped evolve research and the reach into pediatric cancer, what are some of the new breakthroughs or clinical trials that you've been able to help fund?
The way we're trying to solve cancer now is not only exciting, and I think will ultimately be successful, it's really important because a lot of it is either focused around harnessing the power of a child's own immune system to fight the cancer, whether it's immunotherapy or other types of, like we're funding a vaccine study now. So in kids with predisposition, the first sign of that sort of circulating cancer, they would give them a vaccine, hopefully, to stop the cancer from growing, like preventing it. That is huge, but that's using the body's ability, like boosting the body's ability to fight it off. 2 really smart ways that they're targeting cancers based on the exact makeup of that cancer, looking at the markers or what's driving that particular cancer, and then developing something that can shut down the driver, take the driver out of the seat and stop the cancer from growing. Those types of treatments are not only going to be more effective, but they're going to be much less toxic long term for children. So ultimately, we want to get to the day where cancer in children is no longer a life-threatening disease, but something that can be solved. And the kids who are surviving are not having all of the long-term toxicities and long-term side effects that can greatly affect their life, and in some cases lead to additional life-threatening complications. I believe we're going to get there. We've had some successes, and I think there's just more successes to come.
Captain, our beloved service dog, is back for his third year at Vive and Hims. This Week Health is partnering with Alex's Lemonade Stand Foundation to raise $200,000 this year in 2025. It's easy to participate with this. Snap a photo with Captain, share it on social media, tag us, and for every smiling face in the picture, we'll donate $1 to support these families battling pediatric cancer. A huge thanks to our partners, Rackspace and SureTest, for making it possible. Join us and let's make a difference together. Visit thisweekhealth.com to learn more.
Definitely. And great point that most people don't think about when you are battling a disease as a child, what those lifetime effects could be and the things that you're going to have happen to you at 40 that nobody knew about. So that lens into the survivors and then their long-term journeys is something obviously we want to continue to discuss and track and understand as we raise money for the foundation. How do you decide which research to prioritize?
We have a few ways we do it. So we have a scientific advisory board made up of 10 researchers. They guide us. So we have conversations with them around what's happening in the community. We have ideas sometimes based on things we're seeing, and we'll say to them, what do you think about this? How can we help solve this problem? Once we come up with a gap that we think we can fill, with their guidance, we develop guidelines, which basically is like a request for applications. We'll let the community know we're funding these things. And then the applications come in. We have a much larger group called our scientific review board of researchers who we assign them to. Multiple people read each application. They score them. They make comments on them. We get on a call. We discuss them. Everybody rescores them. And then look at how things come out at the end. And the ones that score excellent, we really hope we have the funding to fund, and we will fund them. And then they do progress reports and final reports. All our grants are multi-year. We bring them together oftentimes once a year to discuss and learn from each other. But really what drives our decisions is recognizing gaps and then also relying on our scientific advisors to help us figure out the best way to solve those gaps.
What are some of the biggest gaps in pediatric cancer research today?
Other than the obvious, which is the lack of funding. If we had all the funding we needed, what are the types of things we could address? We're addressing a lot of them already, luckily through bringing young researchers into the field. So filling the pipeline, right, of new thinkers. We're funding innovative research. We're now doing these larger scale ones that are collaborative, but they are expensive. They're $5 million projects each. So looking at what we're doing now, what's on our wish list for the future, I would say more money to the really hardest to cure cancers like brain tumors in children, I would say, is at the top of the list. In fact, we're trying to put together the funds and an RFA for that. Also looking at survivorship, like you mentioned, understanding it more. We've come a long way with survivorship support and survivorship medicine. But from when I talk to parents, it seems to me like there are significant gaps from the parents' perspective or from the survivor's perspective that really are not being met. There's an access issue. I mentioned we help families travel for care. The options you might have if your child is relapsed or has a hard to treat cancer would most likely be different depending on where you live in the country. Globally, there's a huge access issue. The survival rates in the US are probably the highest that they are in the world. In middle and low income countries, they're significantly lower. So there's a lot that could be done there to see if we can get the treatment to the kids that will save their lives. We also have on our wish list looking at disparities and outcomes. Are there reasons that some kids with the same cancer survive and others do not? That's something that's been studied, but there's probably more to be learned in that area. And then there's all the financial needs of the family and all of the resources that families need to get through this.
When you think about that travel and financial burden and the ability to remove some of the barriers to care for families, your travel for care program's been a game changer. It's evolved over time. What are still some of the biggest needs for families? And Why is it so hard for them to access funding either for treatment or for support?
It's the whole ecosystem, right? It's not just the childhood cancer problem. It's just exacerbated by childhood cancer, right? It's a economics problem for a lot of the families. And I would say the biggest need that is not met is financial needs of families who maybe were fine before, maybe middle class families, or maybe they were already struggling financially and just getting by or not getting by. And then you put a childhood cancer diagnosis in there, and very likely that a parent can't work. If it's a single income household, it's exceptionally hard because of the demands on a parent bringing your child to and from the hospital, making those appointments, and then you have your other children to factor in. Can they come to the hospital with you, or do you need to get coverage for them? There's a lot that happens that can really devastate a family financially. As far as resources go, it is a problem. There's quite a few resources out there, but connecting to them can be like a part-time job for a parent. So we now have a full-time resource navigator, and her job is when somebody reaches out to us, which happens daily, and says, my child was diagnosed, I'm really struggling, even if we can't provide everything to them. She knows the other organizations. She calls for them. She doesn't just say, try this group. She'll contact organizations and say, here's what they need help with. Do you think you could help them? And then she'll connect them with them so that they already know they're going to be getting support. We also are creating an online tool that's very close to being finished. Really make it easy for parents to find them if they want to just go online and find those resources themselves and connect to them. I think the financial needs, though, are huge, and they haven't been met because they are so enormous.
A lot of that I feel like has to do with policy, reimbursement, insurance, different resources. How, beyond raising money, does a community like This Week Health and our 229 CXOs, how do we help influence policy and create a better advocacy and support program for pediatric cancer patients? Like, how do you want us to mobilize to impact beyond fundraising?
I think we've all heard this, but it's still true. Childhood cancer is not prioritized in the federal funding for cancer. So generally, they're competing with all the other applicants who are competing for across all cancers, most of which would be people studying adult cancers. So if we could protect more money just for pediatric cancer, which is the number one disease killer of kids in the country, that would be a good start so that researchers know if they want to study pediatric cancer, there's money to do. I would say there's a lot of work to be done on drug development in the industry that is focused on drugs for kids with cancer, not just repurposing adult drugs. There's not enough drug development that's dedicated to children with cancer. I think there's probably a more complicated system than to just say it comes down to the fact that they're not profitable, most likely because of the rarity of childhood cancers in general. But there has to be a way that we can work with industry to develop just for kids, right? Develop drugs that we know are developed for kids rather than repurposing. If you can repurpose for adults, great. But let's make sure that what we're treating our kids with is going to really work on their cancer. Most childhood cancers are unique to children. They're not kids getting adult cancers. They're kids getting kids cancers. And then I would say probably better understanding and utilizing the resources that are available in the public sector through whether it's state insurance systems, making sure that families who have public insurance or state-assisted insurance are eligible for the same things that their friends who have private insurance are eligible for. Also making sure that private insurance can't deny potentially life-saving treatment just because maybe they're experimental. That just doesn't feel right to me. There's a time and a place to deny, but I don't know that it's when there's a treatment that could potentially extend or save a child's life.
And to your point, we can flip the script a bit on instead of adapting an adult therapy to a child, have a child designated therapy that maybe it's applicable to adulthood, but more importantly, that's dedicated just to these kids so they can make it to adulthood. Yeah. When you think about the next 5 years and ALS continues to grow, what's your vision? What do you want to happen in the next 5 years?
We do want to continue to grow. And it's not that we love growing because it's more work and it's more complicated, right? And in many ways, it's more responsibility as an organization, the larger you get in the space. But because of the needs that are so vast out there, we want to be able to tackle some of the problems I talked about. We want to be able to think about what would it look like to help solve the drug development? What would it look like to really be able to help families financially? Those are expensive things. What would it look like to try to make a difference globally in pediatric cancer? Those are topics we've only discussed and basically have decided we don't have enough money to tackle those topics in any meaningful way. That's the goal. That's where we want to be in 5 years.
And the more people that hear about it, the more lens that they can see through it as well. Because we talk to pharmaceutical companies, we talk to policymakers, and the ability to say, hey, what are you doing in this space? Even just opening and asking the question, it leads to a conversation maybe no one's even thought about. Because unless you're
Right.
experiencing something personally or have been exposed to it through something like This Week Health, you may not even know it's a thing because it hasn't happened to you. And yet people love to create meaning in their lives and have a
Yeah.
purpose behind it. And when it's childhood pediatric cancer research, it's pretty difficult to deny that impact and that importance, whether you have children or otherwise. And so I love that people get to learn about what you are doing through these conversations and keep amplifying the impact of what is happening. You've shared some fantastic stories with us in the past, the families that say, we were out of hope and this clinical trial happened to work. We put an extra candle on the cake every year to celebrate Alex and what she brought to that family. What are some recent stories of impact that you've heard that we can share with the community?
For me, just the moments where, and this sounds silly, but on my Facebook feed this morning, I saw a post from a mom who is on vacation with her husband and her son. And she posted a whole bunch of photos and videos of them having the time of their life, their son going down a water slide, just enjoying this vacation. The whole point of her post was they were having such a great time, and she can't help but think that he shouldn't be here because he basically was considered incurable. But the fact that was making this vacation, now he's several years cancer free. And I know that family benefited from a trial. I know exactly what trial it was that Alex has funded. And I just thought, wow, I just went there to look for something else and this came up in my feed and it's amazing. It's amazing.
What would she say 25 years later if she saw what she created and what you have done? What would Alex say about all of this today?
It's so hard for me to imagine, right? Because I think 8-year-old Alex, right? I think I know what she would say, which is, it's good, but we need to do more. And that was her nature. And I guess it's my nature. I think it's definitely my husband's nature. They had a lot of similarities in that way. And then I think, what would 29-year-old Alex say? That's how old she would be now. And that's harder for me to imagine. But I think she would be equally as amazed and grateful as I am. And I think she would be really proud of herself. And I think she would probably say, what's next? Let's keep going. But it's hard for me to even picture a 29-year-old Alex, especially as a mom with 3 boys. I can't imagine having a 29-year-old daughter. Like such a different energy, at least her compared to her brothers when they were younger.
And with that, with knowing that Alex is, okay, we have to do more. Keep it going, mom. Keep it going, community. What message, Liz, do you want to share with our community of health IT leaders who have supported the foundation through the Yellow Hat Club and want to continue to do more? What do you want people to know from you today?
First of all, thank you, because it literally drives everything we do. And secondly, I think there is more to be done. Donating is obviously what drives everything we do, but getting involved, whether it's talking about it, whether it's advocacy, whatever people are drawn to do, right? Everybody has different strengths. We welcome all supporters and we will always find a way for someone to talk to them. And if there's a way they want to get involved, but they're not really sure what it is, we can even talk through that and help them figure out a way to make an impact.
And we continue to think of creative ways as well to spread the word and fund the mission. So we will be coming up at Vive. We'll be at HIMSS. We have our meetups. We have our Yellow Hat Clubs, where if you buy one for $500, you're in the club. If you show up with your hat on, we donate $25. We have a Captain campaign, where if you take a picture with Captain, Holly's service dog, and you have your hat on, it's an even otherwise amplified impact. We're doing a golf tournament the day before HIMSS starts on March 2nd.
In Las Vegas, right?
In Las Vegas, all proceeds go to Alex's Lemonade Stand Foundation.
Oh,
I believe we will exceed our $200,000 goal this year, which puts us at $350,000 for the continuum. It will always be our philanthropy of choice.
it's amazing.
We'll
Thank you.
always support this. And I'm hopeful someday we have you at an event, we figure out the way to all come together to really celebrate everything that Alex made us aware of through her fight and what you and the foundation have continued to do to support the research and the families and the kids who become adults, and knowing that you did that. That was Alex, and how grateful we are for everything that you continue to impart upon us to do better in this space.
Thank you so much. That really means a lot to me. I appreciate that.
Well, likewise, we are just so grateful to know you. Thank you for being a part of our community. And for everyone who's listening, take this to heart. You may not have children, you may not have experienced a child or child in your life with pediatric cancer, but it's real, and the research and the support are necessary. And we are here to help. And if you don't know where to go, call us, reach out to Liz. We'll make sure we get you connected with a way to make an impact and a difference and keep fighting to find a cure for childhood pediatric cancer. Liz, thank you so much for being with us today.
Thank you.
Thanks for tuning into Keynote. That's all for now.
Thanks for listening to this week's Keynote. If you found value, share it with a peer. It's a great chance to discuss and in some cases start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. Love it if you could do that. Thanks for listening. That's all for now.